Why is it then that, people will often feel better, but then suddenly have it flare up again? What's contributing to that?
Sometimes we don't maintain these good habits that we're building on. We go back to our bad habits. We go
Yeah.
back to poor body mechanics. Pain is a good reminder, but when we don't have pain, we easily forget what
Yeah.
we're supposed to do. Return to old bad habits sometimes.
Yeah.
Pain isn't just about one joint, one injury, or one bad day. It's your body asking for attention, and the right guidance can change everything.
Welcome back to the Optimal Health Guide. I'm your host, Michael, and I'm here with Josh Vance, the Optimal Health Guide himself. Josh, how are things going this week for you?
They're going really well. Excited for a
Nice.
new week.
That's awesome. Well, today we're going to be talking about one of the most common frustrations that you voice that people experience, back pain, and specifically back pain that keeps returning. It might get better for a little while, but suddenly it comes back again. So we'll be digging into why does this happen and what are people missing along the way. Before we get to that, though, I do want to encourage people. These conversations are helping you to better understand your body and your recovery. Make sure that you like, follow, and subscribe wherever you listen to these podcasts. All of that helps us to be able to get the kind of feedback that we're looking for. I also want to remind you that we'd love to hear from you. What pain issues or health frustrations are you currently facing or would like to have discussed in future episodes? You can submit your questions at podcast.vancept.com. All right. Without any further ado, Josh, I'm going to hand it over to you with this question. Why does back pain tend to keep coming back?
Okay, so this is a common theme and question, and there's many different reasons for it. But I think one of the principal reasons is what I would call bad body mechanics. In other words, how we move and how we pick things up on an everyday basis. Those movements, even the little movements, putting your shoes on, picking your purse up, picking up the toys off the floor, putting your shoes or socks on, just how we move gets us into problems. It's like probably more than 98% of the time when people are talking about back pain and how it started, it's not anything like major in the sense of, I had to pick up this really heavy thing.
Yeah.
It's like I woke up with it, or I bent down to put my shoe on and my back, got all messed up and I've been in bed for 2 days. It's those everyday body mechanics that are, just affecting you because they're not good movements and they're kind of putting a little micro trauma into your body.
Yeah.
Okay.
Man, I can totally attest to that too, because recently I've been sick. So I've been coughing quite a bit. And there was one point where I was kind of twisted and coughing. Oh my goodness. I had some incredible pain in my back. So that totally reminds me, I had to beware of like, if I'm going to cough or if I'm going to sneeze, I need to make sure that I've got good posture.
Yeah. Yeah. And that almost even sounds a little bit like another frequent reason, weakness. I mean, you were using those muscles so often, they aren't used to coughing that much. But weakness that's persistent and never either taken care of or not even recognized, we don't even realize that we're weak. And so we can't move with optimal positioning and body mechanics because we can't even fire those muscles. We have no clue where they are or how to turn them on. Okay, so that's another frequent reason. Bad daily habits in regards to posture. When we're sitting, when we're standing, when we're doing things, people when standing frequently just kind of lean on different things, maybe.
Yeah.
And I'm not talking about like the wall or anything, but they may kind of lean onto one side on the leg and hip and let that knee just kind of push on back or kind of lean halfway back and just letting everything kind of just relax and not really actively controlling their body. So, that can affect it. And of course, probably the biggest one is sitting posture. And just the daily things that we're doing, those people that are a lot more, their job requires a lot more strength, force, activity, bending, different things like that. Just their daily requirements are a little bit higher. If they aren't in the shape to handle that, then over time, they frequently will get into some problem.
Okay. Well, you've hit on a few things that might address this question, but I'd love to have you elaborate a little bit more. What are there daily habits that kind of quietly contribute to back pain? I mean, you mentioned the leaning or the posture where we kind of compensate that way, but are there others?
Yeah, the sitting posture for prolonged positioning, the body likes to move. We're designed to move periodically. So just
Mm,
sitting in a chair 8 hours a day working, bent over a
yeah,
desk, that's not going to be good. Not
yeah,
only back, but probably neck pain too. So, the sitting posture, the flexibility, do we have enough flexibility in the front of our hips? If we're sitting all the time, I'm guessing by the time we're 60, 50, we're losing some of that hip flexibility because
mm,
unless you're doing something intentionally to actually affect that, we're just going to get tight because we're just spend
hmm,
so much of our time in that position. That then is going to have a kind of a compounding impact. We get tight in the front of our hips. Then when we walk, we don't have enough flexibility. So every time we step, we can't get our leg far enough back, or we do. And then because we don't have the flexibility in our hip, we ended up kind of bending through our low back and pelvis, putting more stress to the
yeah,
low back segments. That just kind of compounds a little bit. So the sitting posture, the poor flexibility, the prolonged sitting, lack of movement, those are all big deals. I think another one is lifting mechanics.
mm,
What are we
okay,
doing? How are we picking things up every day? Like I mentioned
yeah,
earlier, it's those small things, not the big things necessarily,
yeah,
because we all I think most of us think, "Okay, I'm gonna pick up this
yeah.
whatever case of water I bought at the grocery store, and I'm gonna use good body. I gotta think about how I'm gonna lift it." But yet when they put on their shoes or pick up the purse from the floor, they just
Oh,
do it. They don't even think twice about it.
yeah, that's interesting. Yeah, almost like conditioning. We're thinking about it at certain times, but at others, this is just an assumed normal movement I should be able to make.
Right. And yes, we should be able to make it, and we do, but it's like tapping on glass. Eventually you're going to get some cracks on that glass,
I
and
see.
then you keep tapping and that crack's going to get bigger, and eventually you got a problem.
Hmm, that's good. So you've hit on some of this already, but why is it then that, people will often feel better, but then suddenly have it flare up again? What's contributing to that?
Yeah. Sometimes we don't maintain these good habits that we're building on. We go back to our bad habits. We go
Yeah.
back to poor body mechanics. We forget. Pain is a good reminder, but when we don't have pain, we easily forget what
Yeah.
we're supposed to do. So, I think returning to old bad habits sometimes.
Yeah.
Sometimes incomplete recovery. The tissue's not fully healed yet. Maybe we've gotten 4 weeks through this sprain, strain, whatever,
Hmm.
and things are feeling better yet, but we went and did, played golf and we really didn't have the control that we needed. And we re injured it because things hadn't fully healed
Yeah.
from a physiology perspective, but also from a body mechanics and movement perspective. We didn't have the stability and the knowledge and all those things to move correctly while we're doing the activity.
Yeah.
So that plays into kind of overdoing activity too quickly, when we're not strong enough for the demands that we're placing on our back.
Yeah.
And I think probably one other reason is just ignoring our good habits, good movements, and ignoring that need to maintain. I mean, you put oil in your car, you check your gas, you check your oil, you
True. Very
kick
true.
it in. Well, your body's the same. You got to keep the maintenance going. If you don't,
Yeah.
you're going to have problems. So not maintaining it in the way that you need to is going to flare up.
Yeah, that's very wise feedback right there. Is there a time where reoccurring back pain is actually a sign of something deeper happening?
Can be. Sometimes we can have actual segmental instability where, you may have one segment that's actually shifted relative to other. I'm not talking about a disc. I'm talking about the bone itself.
Hmm.
That's a potential reason. So there can be
Yeah.
structural issues that would probably likely need surgery. Other things that could be a sign that there might be something is the nerve involvement where you're getting numbness, tingling, burning that's persistent and not getting better even after, some therapy, and you're doing
Yeah.
things to get better. There's things that need to be done potentially for that. Also that sharp shooting pain going down to the leg, that might be a little cue that there could be something going on.
Hmm.
Unexplained weakness in the leg muscles
Okay.
or kind of gradual weakness over time. And even frankly, sometimes losing balance, decreased balance. If
Hmm.
if we're suddenly having more instability or
Hmm.
falls and things like that. And there may be something more significant going on that needs to get checked out. And that can be certainly a very important thing that would need to be checked off.
Yeah.
I think one more possibility would be repeated flare-ups and or increasing frequency of pain. So, if we keep flaring up, maybe 2 years ago I'd have, a couple days where my back gives out and I'm bedridden for a day or two, and then it kind of gets better. Well, now it's
Hmm.
happening every 6 months or 3 months, and the frequency of pain is
Interesting.
getting more often, and the severity of pain may be getting more significant too. Those could be an indicator of some potential problems as well.
Okay, that's really helpful. Well, we've looked a lot at things kind of from the negative end of the spectrum. What could be going wrong? What about like moving toward lasting recovery? What is it going to require for somebody to actually move toward lasting recovery?
Hey, that's real important because that's what we all want.
Yeah.
So to move towards that, we got to have consistency. We need good body mechanics. We need good posture. We need to be aware of where we are throughout the day and aware of what we're doing. We got to have good strength. And I'm not just talking about kind of our back itself, but our belly muscles, our butt muscles, our core, the hips, your spine muscles. Not only that, but we also have to have good mobility of the hips and spine joint or segments, as well as muscle flexibility. All those things play a role in whether or not we can move with optimal mechanics and optimal normal movement ability as far as flexibility and range of motion. Confidence, that is an important thing because we need to be confident that we have good quality body movements and good quality body mechanics regularly with the things that we're doing. If we're, a plumber and we got to do a lot of bending over and all that, and man, we got to have that confidence that we know how to move correctly and we can use those muscles to help stabilize us while we're doing our daily things. I think lastly, long-term habits of being aware of how you're moving. Again, that's that internalization in your head. I
Yeah.
know where my body is in space. I know that I'm firing these muscles that I need to keep my back in that ideal position to make sure I'm not putting extra stress on things. I'm exercising on a regular basis to maintain strength, to maintain flexibility and mobility. And I'm
Hmm.
always thinking about those good body mechanics with putting my shoes on, or of course, lifting the groceries, the
Yeah.
heavier things, but particularly the everyday things too.
Hmm. That's really, really helpful, Josh. Thanks so much for that. Well, if your back pain keeps returning, don't just chase temporary relief. Learn more, or you can schedule a consultation at advancept.com. Because again, we want to see you moving toward optimal health. Thanks everybody for listening in today.